most common inversions are right headstand, shoulder stand. Maybe if you add in like a handstand, there's like semi-inversions, you know, like down dog. An inversion, your center of gravity over your heart. When your center of gravity is over your heart, blood flows to your heart. When blood flows to your heart, it increases heart pressure, blood pressure basically. When the blood pressure increases, you have these baroreceptors that measure pressure, basically not like a scientist, but you know, that indicate pressure to your system. When blood pressure increases, it causes your vascular system to dilate. When it dilates, that lowers blood pressure. So you invert, at first blood pressure increases, then the vascular system dilates, then blood pressure decreases. So if you can survive an inversion for about 30 to 60 seconds, beyond that, your blood pressure lowers. And then all kinds of benefits, because you lower your blood pressure and you can start to remove cortisol from the system and just lower stress. Plus it feels really good. So that's kind of like the theory of like, why do inversions? But so the system that I'm teaching, what originally was called dynamic visualization, the spotlight imagery is basically the method that I learned from my Ashtanga teacher. His name is David Garrigues. He lives in Philadelphia. But it's a method for people that do Ashtanga. And if you do the first level 1 Ashtanga, then every day you're doing like 5-minute headstand, 5-minute shoulder stand. And so you do that for like a year, 2 years, 3 years, you can do a 2-hour headstand workshop and you're going to be fine. But if you don't have that in your system, if you don't have the muscle memory and a little bit of the bone deposition, when, you know, there's a law in physical therapy called Wolff's Law, where when you apply pressure on a bone, basically your body will start to preferentially deposit calcium there. And so you see like gymnasts, and they have these huge wrists. They weren't born with that. They just applied pressure all their life, and it grows, it gets bigger. And so you do that with your neck and with all of the bones that you apply pressure to in yoga. And so you all might not have that foundation to do like a 2-hour, 2.5-hour headstand, shoulder stand workshop. And you might survive it, but then tomorrow you'll be driving, a little spasm will happen, and then that makes the whole workshop not worth it. So there's that side of it, but then we're also all here probably because we want to invert. We want to go upside down. Maybe you haven't gone upside down, you want to learn how to do it, or you're doing it, you want to improve it, or you got it good and you just want to learn some variations, or you got it all, you just like to be in a group. And I'm pretty flexible in the mind to change exactly what we're doing like that. You know, it's very easy. And so when you guys, I'm going to ask for a little bit of input on what you were expecting or anticipating or what you were desiring in this class. And based on that, I can kind of quickly